As if being pregnant isn't hard enough sometimes, you may have been recently told that you have prolapse, or you were Googling it and you're like, I think I might have prolapse. Some of the signs that you might have prolapse are if you're experiencing any type of incontinence. If you are leaking urine, even a few drops, or perhaps you are passing gas and accidentally are pooping at the same time, or maybe you're full on like peeing your pants or pooping your pants, these could be a sign that you might have prolapse. Something else that points to prolapse is changes in sensations that you're feeling during intercourse. You might have extra dryness during intercourse, or just pain in general when you're trying to have sex. These could mean that you might have some prolapse. If you're wondering what exactly it is, if you think of your pelvic floor muscles as a hammock holding all of our organs up into our body, and what prolapse means is either your rectum or your uterus or your bladder, one or a combination of a couple or all three of them, are coming down through that hammock with increased pressure in our abdomen. Increased pressure usually happens with a lot of force or different exercises. Maybe you're lifting something heavy, and some of those organs just bulge down. This sounds really scary, but it really isn't. It might be uncomfortable because you might have a feeling of like heaviness or bulging out of your vagina. You might have a draggy sensation. Whatever your symptoms are, those are definitely an inconvenience, a problem, something we want to work on, and they shouldn't be swept under the rug. But it's not something that should make you feel totally defeated, because there are some things that we can do to prevent a prolapse from getting worse during pregnancy, and then also repair or recover a prolapse after pregnancy when you're more in a healing phase. So some of the things that you can do are learn how to get into positions of relief. So something that often makes the prolapse symptoms worse is a long day on your feet. Maybe you went for a run, maybe you were lifting at the gym, lifting your toddlers a lot. I think of my poor daycare provider and how she's always holding one of those kids, and she's pregnant right now, and I would imagine that definitely puts extra strain on her pelvic floor, and so she would maybe feel symptoms of prolapse by the end of the day. So what you want to do is you want to find a place where you can get your buns or your pelvic floor up, elevated, and take the pressure off of your pelvic floor. Let gravity kind of give it a break from gravity, I guess. And you let those organs just fall back down into your abdomen. And when they do, your pelvic floor will relax and feel a lot better. So here are some pictures of some of the positions that you could use to try to take that pressure off of your pelvic floor. Another thing that you can be doing is strengthening your core and your pelvic floor muscles. I've done a lot of videos on this, so I don't want to beat a dead horse here. Click the link to my video about belly breathing, which also talks about core activation. And then here is a video up above about Kegels and how to actually strengthen your pelvic floor with your breath work. A combination of all these things are going to make sure that you are activating the right muscle groups when you go to lift a heavy box off of the floor, or you're moving patients around because you're a nurse. These are times when there's increased pressure in our abdomen, and when that happens, it pushes down on our pelvic floor and it can make those organs want to come out, and that's when we notice the symptoms of prolapse even more. So if we can do things to tighten and protect and avoid that bulging out, those are going to make our symptoms less, hopefully. Something else that you can be doing is to use different positions during intercourse. Use a good lubricant that is going to keep things from getting dry, and having open communication about what sensations are different than they were before, so you can try to avoid things that irritate your prolapse, and work on and try things that might feel a little bit better. I actually created a postpartum course, and in that course there is tons of information about the changes that can happen with intercourse after having a baby, but that might be relevant to you now. So if you want to check that out, there's a link in the description below. Have it now, and then after you have your baby, maybe revisit it. It would probably still be helpful at that point. Another tip is to avoid constipation. Constipation itself probably isn't going to make your prolapse worse, but when we bear down with bowel movements that are tough to get out, we are actually causing those organs to push out and we're putting more stress on our pelvic floor, which is already probably weak if we are experiencing prolapse. So if you click on the video above, you will see some tips about positions that you can use and some massage that you can use, just different ways to alleviate or prevent constipation so that your bowel movements happen a lot more easily. Another tip is just to, in general, stay healthy and stay active. Sometimes we feel like, oh, I have prolapse, especially when we're pregnant. There's lots of reasons we can find not to exercise because we just are tired and we don't feel that good. But I'm telling you, if you ignore it and you don't address your strength issues, whether that's your core or your pelvic floor, or you gain a lot more weight than you really need to, we get things like sickness, because we know that exercise actually boosts our immune system. And if we get a cough or we have asthma exacerbations or things like that, a respiratory infection, hello coronavirus, right? We actually, every time we cough, are putting more strain on our pelvic floors. So we don't want to do that. We want to avoid things that are going to strain our pelvic floors. And in general, just being overweight, being weak can definitely cause things like prolapse to get worse. So we want to stay healthy. And a big tip for this is not being depressed or feeling defeated about your prolapse. So you might feel like, well, I'm pregnant. What can I do about this? There's so many things happening to my body, and I'm going to pretend it's not there and I'll address it later. But really what that does is it just creates this cycle of weakness and it gets worse. And trust me, after you have the baby, there's going to be 1,000,001 reasons why you're not going to want to exercise at that point too. So create some good habits right now. Get into a routine that incorporates pelvic floor and core strength. Comment below if you want some specific people that I highly recommend their workouts, because I think they're awesome at engaging pelvic floor and core with any type of workout, whether it's cardio or strengthening. And just don't let it depress you. There are definitely people who still do CrossFit, who still run, even with prolapse. We can do things like pessaries to make sure you can do those activities. Worst case scenario, there are surgeries that you can have done to repair a prolapse. But the research does show that pelvic floor strengthening is the first thing that you should try. And it can be very helpful, especially if you catch your prolapse early and you really get on top of it and try to keep everything strong as much as possible. So those are my tips about dealing with prolapse during pregnancy. Comment below with any questions that you still have, and subscribe to my channel if you love information about pregnancy. When you subscribe to my channel, it gets this video out to more people and it can help more moms, and I just want to spread the love. So thanks so much for joining me today, and I will see you all next time.